I'm very pleased to welcome you to the first Quebec-based symposium on young carers. Many of those who encounter young carers in schools and in the doctor clinic are likely to wonder, what the heck are we talking about? Up until now, we didn't have the vocabulary to describe it, and if we not properly support them, they may well be subjected to the negative consequences to their physical, social, and mental well-being.
When I was 16 years old, my mom started to show some disturbing cognitive difficulties. My mom couldn't get clothed on her own. And it was also similar getting her to go to the bathroom. Like, if I had to sum up my life since I was 20, caregiving is the only thing I know.
My mom was diagnosed schizophrenic. Nobody ever pulled me aside and explained it to me. It's frustrating, it's difficult, it's very isolating, and you're kind of playing whack-a-mole with your life.
1 in 1,000 young carers in Canada are receiving dedicated supports, and this is compared to 1 in 14 receiving better supports across England and Wales. That puts us as one of the largest global young care cohorts in the world, yet we have some of the least amount of resources.
Young carer cannot seek for help because they do not have the financials, they do not have the ability to ask, and they are invisible.
We're talking about an invisible problem here today. We're trying to make visible an invisible problem.
I myself have lived with a mentally ill parent, so my mother struggled with depressive and anxiety symptoms. For all those reasons, it was really important for me to work with that and try to find strategies to make children more resilient.
Community engagement and the community position of a pediatrician and primary care person should involve the whole family.
And in this particular Canadian development, it was the Alzheimer's Society of the Niagara region that essentially spearheaded the young carers movement in Canada. There was upwards of 75 children that were in rather primary caregiving roles, and the consequences that they were observing were things that we see in the research: problems in school, getting in trouble, suicidal ideation, self-harm, because these kids didn't know how to handle the burden of the caregiving. And essentially, out of this came the first Canadian Young Carers program, which you'll hear about from the lovely Michelle here.
Dr. Heather Chalmers, who's a researcher out of Brock University in the Child and Youth Studies Department, she conducted the very first Canadian study on young carers. And we used the research from that study to gain funding. And in 2008 is how we were able to start Powerhouse. We asked the kids, because of Powerhouse and certain programs that you participate in, what are the outcomes? And they say that their life looks brighter, they feel like they matter, they're less lonely. Our approach is not to have powerhouses plunked all over the place, it's to build that professional capacity to help teach others how to do it.
We need to really talk about young carers and young caregiving as a rights perspective, right?
Yesterday, it was a big day in Quebec for the budget, and I was not supposed to have money for caregivers because the policy is not done, but I got 21 million. So it means I'm gonna be able to act right now.
Designate someone, please, in each group to write down the answers on your provided paper, and then that person will be then asked to summarize your discussion.
What do you think should be the first steps in moving the Young Carers agenda forward?
Educating the educators.
Government leadership, research, training, and a lot of questions and conversations.
A financial compensation or allocation.
What could be the role of the education sector?
One of the tools that could be used is a PSI in the school network.
If it was part of the curriculum of teachers, for example.
How can we engage these sectors?
Collaborations with different groups and sort of cross-institutional.
Finding champions, the young carers themselves, to have their own voice. Do you think of any other sector that should be involved?
Legal sectors, community organizations.
Churches, mosques, synagogues. What do you think may be the biggest challenge in moving the young carers agenda forward?
Translating policy into action.
A willingness on everybody to identify this as an issue.
Every family who is going to come to us, we're going to ask, okay, what's happening not only with your son with schizophrenia, but what's happening with your other children?
We need to recognize what caregivers give to the society. And I don't talk about saving costs for healthcare, but helping to make our society more compassionate and human. You will not be invisible anymore.